Welcome to Dental Vibes. I'm Gabby.
And I'm Carla.
And if you're new here, we are dental assistants that love to talk about dentistry.
A lot.
And in this channel, you can see content for our fellow dental assistants and also for anybody that loves their teeth and want to take care of them.
And if you're returning back to our channel, thank you so much for your support. And hey, since you're already here, go ahead and click the like button. And if you haven't subscribed yet, please do so. And also hit the notification button so you don't miss any of our upcoming videos. And today we're going to talk about how to remember the steps for composite procedures.
So we've been getting a lot of messages asking us how can we remember all the steps on every procedure? How am I going to know what the doctor needs before the doctor asks me? Which it could be very difficult at first, you know. I mean, for newbies, that's the #1 challenge that they face is, you know, how do I know all the steps for every procedure? So we decided to pick composite because it's something that most practices are going to be doing every single day.
Right.
And because Amy J, we got to give her a shout out. Amy J asked us to do a video on composites. So here it is. We're going to give you guys 3 tips on how you can remember the steps, the setups, the materials, and we don't like to say, hey, memorize things. You know, these tips are going to help you kind of learn these things a little bit easier, but also you can apply this for every procedure.
Yeah, pretty much.
It doesn't have to be just composite.
So let's get started. Our tip #1 is carry with yourself, or like in your pocket, a little notepad. And you want to basically jot down everything that you see the other assistant is setting up and what the doctor is going to need for in this case the composite procedures. There is like a standard setup, but you gotta know the little special instrument or, you know, whatever that specific doctor may be using, because yes, they all, you know, will have slight variations. And also make sure that you keep your notes organized.
Yes, tip #2, organize your notes. Organize your notes,
because you don't want to put like in one page one word or like a couple words, and then the next page it's another setup, and then it like is keeping it organized, because when you go home and you want to review it, how do you understand everything? And true story, I've seen it in interns notes, and I'm like, what are you doing? You need to make sure that it's clear so you can understand, or if you need notes on specific things that you can go back to it really quick and find it. So literally, like, I would put composite materials, all the materials that doctor uses, composite setups, all the instruments, composite steps, every single step starting from #1, which is like you putting topical in a patient's mouth until the last thing, which is polish. Getting like a little too much. I don't know about this anymore. Like, is this like a course? Are the dental assistant schools paying us to do it?
No, I'm just kidding. No, but it's a lot.
It is.
It's a lot. I mean, maybe we should open a dental assistant school.
Maybe. But also, we were talking about taking photos.
It's actually #3. It's 2020. You have your phone. You have your camera.
Yes. If you like, even right now, I'm as a sub assistant. Like, I go and I'm like, hey, what's the setup? I just snap a picture, and you can even snap a picture of your own setups and kind of like test yourself if you did good afterwards, or see what you were missing, because it's just easier to have that visual image. For sure.
Funny thing, now that we're talking about pictures, I remember when you started subbing at my office, I think we were gonna do a big implant case, and you were not working that day. And you text me and you're like, hey Gabby, after you're done setting up your room, can you take pictures of the setup and send it to me, please, so I know if I have to do it one day. So that just helps so much, and you can check yourself, make sure you got everything before you say, hey doctor, I'm ready, because you don't want the doctor to come in, sit down to start, and you don't have your setups
right. And now we said 3 tips, but we're gonna throw a 4th one. Actually, a 4th tip is understand why, right? The reasoning of why are you doing every step in that particular procedure.
Yeah.
And people are gonna roll your eyes at you, right? Somebody comes at
It's
you.
like, geez, you're gonna ask this
You
again?
don't know.
But it's okay. You gotta keep asking, because you know what? That's gonna make you think about what the doctor needs next before the doctor asks you, because you're gonna know.
Right.
Like, okay, well, I have to do this because of this.
Yes.
And then after that, I have to do this because that just goes together.
Yeah.
So when you understand instead of just memorize the steps, you're just gonna get it so much faster.
Yeah. So with all that, let's just get started. Let's move into the office.
Before we move into our operatory, I want to go ahead and show you guys our Dental Vibes sticker.
I love that.
Yes, so we wanted to thank everybody that's been purchasing our stickers. We cannot believe we sold out in like a day.
Yeah.
So it was awesome. If you like to purchase a Dental Vibes sticker, we're going to leave the link under our description.
Yeah.
So make sure you get yours. Alright guys, we're back in our operatory. We're going to go ahead and show you what a setup for a composite should be like.
Yeah.
So obviously it's going to be a little bit different in every office, but this is kind of like the basics that you should see everywhere.
Yeah.
We're going to go ahead and start with the instruments. So pretty much, I would say hopefully in your office it's like that, but that's the easier way to go, is all the instruments for the composite is packed together on the same pack. So everything that you need is in here. So you just grab it, you don't need to think about anything else.
Sometimes, just real quick, the composite and the crown prep instruments would be the same. Or,
yeah, because it's similar.
Really close, so pay attention to that.
Right, good point. Next thing you're going to need is your high speed and your slow speed. So obviously you're going to need your burst because they go together, right? So high speed, slow speed, burst.
Yes.
Check. Got it. Okay. Now, what kind of restoration is it going to be? Is it going to be an occlusal, a buccal, right? A lingual? Then you don't have to worry about matrix.
Yeah.
So that's that. Now, if it is going to involve the interproximal, then you need to figure out what matrix that your doctor uses. So either you're going to need a Toffelmeyer, right? And it's gonna need a little Toffelmeyer band, right? So you're gonna need that, or it's gonna be something different, like something a little bit fancier, like this. So you want to make sure that you ask your doctor what he or she prefers, so you have that down. If it is an interior, then you're gonna need a Mylar strip.
Yep.
Okay. After that, you're gonna need obviously a curing light.
Very important. By the way, that's happened to me a lot that I don't have it.
Oh, well, usually though, in your operatory, you're gonna have that on a counter.
Yes.
So like, it's already there. You could just kind of, even if you forgot it, it's like right there.
Well, the thing is, I used to work in an office where there was like a spare room. So if you went there and you didn't have the light,
and then
like you were doing a quick filling there.
Yeah, that would be bad. So. Next thing that you're going to need is suction, right? So some offices out there are doing the Isolite or the Dry Shield.
Love it.
Yes, the Dry Shield is awesome. That's what we have here. So if you have that, then you're going to need to get the attachment. Usually I always start with a medium. This one's a large, but I always start with the medium, and I always have a backup, either a small or a large, because if it doesn't fit in the patient's mouth, then you have a backup that you can switch really quick. And you're always going to need your saliva ejector, right? Always.
Yes.
And then if you don't have the Dry Shield Isolite, then the good old high suction, right? So I think
that's your side.
That's it for instruments, and we're gonna walk this through again when we talk about the steps.
Yeah. Now over on this side, as far as the actual materials, well, let's just start real quick. It's not really a material, but something you need. Even if you're using something like the Dry Shield or another isolation system, you do have the dry angles if your doctor likes them.
If you're doing the posterior, the maxillary mostly.
Sometimes cotton rolls, even if they're working on the upper, just to retract their lip, or if you're working on the lower teeth and you don't have the Dry Shield to retract the tongue, you're gonna need several of those. And and gauze just for general cleaning.
One thing I will say about gauze and cotton rolls, try to make sure that you don't get a bunch and put it on your tray so it doesn't go to waste. So what I do, if I'm not sure if the doctor is going to use it or not, I put it to the side. So if we don't use it, then I can go ahead and put it back, because doctors hate wasting supplies.
Yeah, good one. Because they do.
Yeah.
Okay, then we have our caries indicator, and they stated there.
Some doctors use it, some doctors don't.
Etch, of course. You have your packable composite. Sometimes it also comes in like a syringe, and the doctor would grab it with the instrument, but it's usually in a little gun. Flowable. What else we got? We got a little articulated paper. We have, okay, so this is just kind of like 3 go together. Your prime and bond, or if it's just self-etch and bond, you know, whatever they're using, you apply it with
microbrush. Or I mean, there is a bond on the pen.
Yeah, that has its own brush attached to it. Yeah. You got your little wheel if you need it. And then also on this side I have, just for show, different type of anesthetics. For the carpules, you need your needle and your topical.
And again, every doctor is different. Some doctors will not use long needles, they use short all the time.
Yes.
Some doctors will mix and match. Some doctors will only use one type of anesthetic. Some doctors. So it's all about asking.
Yes.
Just ask what your doctor prefers.
Absolutely.
That's gonna make your life a lot easier. One thing that I forgot, I don't know if you consider that instrument or materials, but floss.
Oh,
so
floss.
If you are doing a filling that involves the interproximal, then you definitely want to have floss, because the doctor is gonna check the contact after the filling is placed. I did work for a doctor once that did not need floss.
Ever?
No, because he didn't check the contacts. But you know, don't work for that doctor. But that's pretty much it. And again, we mentioned this already. Take a picture of the setup from an assistant that's been there for a while, so you know if you're missing something, you can compare it to that photo.
All right, guys. So we're gonna go step by step, right, on how the procedure of a composite should go in general. Now, we keep saying it, the most important thing is that you understand why each step is happening.
Play the scenario in your head.
And I mean, I actually still do that every time I set up. Oh, what am I doing? I kind of rewind that in my head, because that way you don't forget anything, and if you're still learning, it will help you remember things much easier.
Let's give a scenario.
Okay.
Let's say we're doing a composite filling on tooth number 13, and it's gonna be an MO. Okay. Okay. So what do we know? We know that it's a upper tooth. We know that it involves the interproximal, and we know that the patient is gonna need to be numb, obviously, right? Yes. Because if it was a small occlusal, some doctors don't numb for that.
Or a occlusal or a buccal.
Or So we know those things already. Yes. So the number one thing is anesthetic, right? Before you get started. Right. Hopefully.
Oh, and by the way, we also would do anesthetic, because when you place those matrix over the gum, it hurts. Right. So you also want to make sure you know the
good point. So one thing that I mentioned before, let's make sure we don't waste product. Yes. Okay. So you only need a little bit of topical. You don't need to grab a lot. Yes. So we know we need to place topical in a patient's mouth. We get a little bit of topical, we put on the area that we know the injection is going to go into, and then we set up our syringe.
And it's not just because of wasting product with the topical, but if the patient swallows it just a little bit, it actually numbs temporarily their throat, and it's like they can't breathe.
Yeah,
it's it's very uncomfortable, very scary.
Doesn't taste good.
And even like when after, I'm getting ahead of myself, but if the doctor after the administers the anesthetic, the injection, if it leaks a little bit, also you want to like rinse them out quickly so they don't swallow that.
Yeah, definitely. That's a nice thing of a dental assistant to do. Second step, okay, Patient needs to be numb. Let's say you check on them a few minutes later, they say that they're numb.
Okay.
So we're gonna get started.
Yeah.
What's the first thing? We need to remove the cavity, right? What is the doctor gonna use to remove the cavity? Probably gonna start with the high speed. Okay, so you have your high speed, you have your burst. Doctor's gonna start removing the decay.
Yes.
Removing the decay, right?
And just really quick, you have probably already placed your Isolite or Dry Shield.
I thought that was obvious, but yes, that's a good point.
I mean, just like if we're going really step by step.
Yes.
Or if you don't have any of those, you have your high suction ready.
Yeah, as soon as the doctor picks up the high speed, you're picking up your suction.
Yes.
Right? So that's obvious, okay? Now, the doctor has been cleaning out the cavity for a little while.
Yes.
It looks like he's done, but he's looking in the mirror, like, right?
Yeah,
Where the doctor's like,
no.
looking at different angles. Now, what should be in your head? Okay, well, looks like it's done.
Yes.
But he's not sure.
Yeah.
So what is he gonna need next? The caries indicator, right? Because that's what most doctors will use when they're not sure if they got all the decay out or not. So you already, like you're sectioning here, you already grab this, and then they look at you and they probably say, thank you, that's exactly what I was gonna ask you. So then they put that on the tooth, they're gonna rinse it out, so you're always gonna have the suction in your hand ready to suction whatever.
Yeah.
And then they will figure out if the cavity is all clean or if they need to keep drilling. Right?
If you're not familiar with the caries indicator, it's basically staining the bacteria, and not only the bacteria, but it will stain everything.
So be careful.
It flows very easily. So yeah, be careful with that.
Be careful with that. It will stain everything.
And if there's still some, they would keep drilling. Maybe they will switch. That's when they will switch to the slow speed.
Now here's a quiz. Right? Actually, I need you to put on a comment right now if you know the answer. Just put a comment that says, I know the answer. Okay? So, why would the doctor start using the slow speed? I love you.
I know.
Okay. So, it's because if the cavity is getting deeper and the doctor is concerned about the pulp
Getting too close to the nerve.
Then he's going to use something that's going to be more delicate,
Yes.
right? So he's going to use a slow speed to remove the remaining decay, but it's going to be a lot more gentle, and he or she is going to know, hey, I know that I'm not going to, hopefully I'm not going to hit the nerve if I use this slow speed. So again, knowing why you need to use certain things really helps. Okay, so now cavity is clean.
Yes.
Cavity's clean. What do we do? What's the next step?
So because it was involving the interproximal, you want to place your matrix so that you can create a nice interproximal contact and shape the composite very nicely. And there are several ways, so let's just get this out of the way. We're not working on the interior tooth, so we forget about the mylar. We didn't pull this out. We would use either your traditional Toffel-Meyer and matrix band, which I don't know where it went.
Which hopefully, if that's the case, you know how to set it up.
Yes.
Because it could be tricky.
Yeah,
I remember
there's
when I first started.
Or we have the half system. I call it a half. There is actually an actual system, the Garrison, but this one is not really the Garrison. It's right. Something.
I think it's like a knockoff.
It's in the familiar.
It's in the family. But anyway, so you're gonna have your little band.
The little band.
You're going to need a wedge after the band is placed to secure the band, right?
Well, you actually also need a wedge if you're placing the traditional Toffel-Meyer and matrix band.
Yeah, you're always gonna need a wedge. And then after, you're gonna need to place your ring.
Yes.
Right? So all of this, whenever you put in your head, okay, doctor is ready to fill. What am I gonna need? You already get your band, whatever system you have, in line up, so you could just hand it to him or her right away. Place the band. Okay, so then the doctor is going to probably ask you for a burnisher to burnish the contact, right?
Right.
So everything looks set up.
Yeah.
We're ready to fill. Okay, so we're ready to fill. What does that mean?
It needs to be very nicely isolated. Although we're gonna start with the etching.
We're gonna start with the etch.
Clean the prep.
We're gonna start with the etch. Why? Right? Because the etch is an acid that is going to clean the wall of the prep. So that's why we need to make sure everything is clean and dry before we bond the filling.
Exactly. So that's the blue thing. It also tastes horrible, and I've tasted it.
Yes, so make sure that suction is right there.
You're using the high suction to suction that. Sometimes maybe put the little saliva ejector if you already have the dry shield.
Right.
And after that, it needs to be dry.
So there is a specific look that you're looking to know if it's etched, right? So the tooth needs to look chalky. So you etch, you rinse the etch off, obviously, then you're gonna dry the tooth. And you're gonna see the doctor is gonna be drying to see if he sees that
but not
chalkiness.
over drying it that much either.
Yeah.
I mean, because then that creates too much sensitivity after the filling is placed.
Right. So
just enough until you see the difference.
Yeah, so then you see that chalkiness, okay, we're good to go, and then that's when the isolation comes into place. You don't want any of the saliva to come into the tooth because or else your filling is not going to be bonded properly.
Yeah.
So you isolate with whatever you need, right?
A little triangle, maybe. Okay guys, so our camera just died, so we're gonna continue on with our cell phone camera, you know, like back in the good old days.
Back in the good old days.
Yeah. So after the tooth is dry, you put cotton rolls if you need it to just make sure no saliva goes into there, and you start applying your prime and bond. It may be 2 little bottles or 1 bottle with both things, and then you light cure that after the bonding.
Yeah, it depends. Some doctors like you to do it, some doctors they do it themselves. So after light curing, we are ready to place the filling.
Yes.
Most doctors will line it with a flowable composite first.
Especially when in this particular scenario there's a matrix.
Exactly. And then you're gonna light cure it again, and then composite and packable will go in, and they're going to start packing that in.
Yeah.
Every doctor is different. They're gonna ask you for something different so they can pack that.
Yes.
Light cure it again. Ta-da!
Done.
And you're done. But you see how you walk it through
Yes.
in your head. Okay, numb, then I have to clean the cavity.
Yes.
Then I have to make sure the cavity is really all gone. Then after that, then we need to isolate the tooth with the band, right? Then after that, I need to clean the tooth. Because it just makes sense before you put the filling. After that, we need bond so the composite can stick, right? So bond needs to be placed.
Yes.
Then you need to fill the line,
the tooth,
the line, the base of the tooth. Then you need to put your composite and shape it. So it's like it all starts to
and if you're unsure, you can always talk to the dentist while you're doing things, right? I mean, that's so important of having good communication with your doctor.
Yeah, always ask, hey, while the doctor is packing the composite, you can say, hey, are you done or are you going to need more? Because if the doctor is done packing, you can go ahead and drop your gun. If he says, no, I'm going to need more,
or you may need another carpio,
then you know. Exactly. So communication is very important, but it's going to get to a point where you literally don't have to
read
say
each
a word.
other's thoughts.
You would read the doctor's mind, and you would think about things before the doctor even thinks about it. So it's gonna get to that point. So don't be so hard on yourself. Just keep on working, and eventually you can do this while you sleep.
Okay, now let's start contouring the filling, right? So we're done. We're gonna take the band out, you know, any cotton rolls that there may be there, probably place a new one if the doctor likes to have the lip retracted. And you may need your polish and burst out, make sure you have that. And what do we start doing? Checking the bite.
Checking the bite. You want to make sure you have your floss so the doctor can check the contact. And then, you know, when it comes to contouring, every doctor is different. Some doctor likes to do the rough contour first, and then they check the bite.
Everything,
but just make sure that you have everything for that, because you know at some point you definitely need to check the bite. You know you definitely need to check the contact, and you know the doctor is definitely going to polish. So as long as you have all that on the tray,
you're good.
You're good to go. So these things are
very repetitive day after day,
Yes.
and it's just gonna get to a point where you just can do this with your eyes closed.
Yeah.
It's just practice. Make sure you keep open communication with your doctor.
Yeah, if you don't know anything or you're like, oh damn, I froze, I don't know, talk to your dentist. It's like, what are you gonna do next? Do you need something? And
yeah,
you should have that communication. So if you don't have it, establish it or
exactly. So it's like you need to communicate, but it's gonna get to that point where you guys don't need to say a word.
yeah,
You're just going to like work together like you never like spoke before. You just can read the doctor's mind.
Yes.
We know this video was a lot.
Yeah.
It was a lot to handle. It's a lot of steps.
Yes.
But we really hope that we gave you some good tips to help you memorize your composite procedures, get your setups right, so you don't make any more mistakes. Now, definitely let us know under the comment if you did this when you went back to your office, but also we would like to know if maybe your doctor does composite completely different than what we told you.
Yeah.
So make sure you leave us a comment and let us know.
And if this video really helped you, please don't forget to give it a like. And also subscribe, because really we need all the support. We're very thankful, but you really, by supporting us, help us grow more so that we can continue to put videos out there every week. So make sure you hit the notification button so you don't miss our weekly videos. And we'll see you next time. Keep smiling.